Hi everyone, it's May here. Welcome to Scrubs University. In this video, we will master how to prioritize nursing care using clinical reasoning. Suppose you have two patients that are both crashing. One is gasping for air and the other one is bleeding from their arm. Who do you help first? This is one of the most common and important questions you'll face as a nurse. Prioritization helps you stay calm and make life-saving decisions. So today, we're going to break it all down using clear frameworks and easy examples. Let's start with the basics. Prioritization means deciding which patient needs your attention first and why. It's about managing your time and energy where it matters most. As a nurse, every decision you make can impact patient safety, patient outcomes, and in some cases, even patient survival. This is why it's so crucial to have a strategy in place, not just for passing the NCLEX, but for thriving in clinical practice. Let's take a look at our priority setting frameworks. The gold standard is the ABCs, which stands for airway, breathing, and circulation. If a patient doesn't have an airway, nothing else matters. Always ask, can they breathe? Are they oxygenating? Is their circulation intact? Let's look at an example. You have one patient with a broken arm and another patient that is choking on their food. Who do you help first? In this scenario, the choking patient comes first because they're experiencing an airway problem, and airway is our top priority. So you will help this patient first and then move on to the patient with the broken arm. Next, we use Maslow's hierarchy of needs. Think of a pyramid. At the base are our physiological needs like air, water, food, and pain management. Above that, we have safety needs, such as having a stable environment, knowing what's coming next. Above that, we have love and belonging, esteem, and at the very top, self-actualization. As nurses, we always start at the base of the pyramid and work our way up to meet our patient's needs. Suppose you have a patient that is anxious about their upcoming procedure, and you have another patient that is experiencing 7 out of 10 pain. Because pain management is a basic physiological need, it comes before safety. So in this case, we would have to address the patient in pain first and then work our way up to helping our anxious patient. Lastly, we can prioritize our patients based on whether they're acute or chronic, or stable or unstable. Always prioritize acute over chronic and unstable over stable. Chronic illnesses are ongoing and manageable, but acute conditions like a sudden drop in blood pressure or chest pain can spiral quickly. Similarly, stable patients can wait for our attention. Unstable patients need immediate attention. If you have a stable COPD patient, chronic obstructive pulmonary disease, and you have another patient with sudden onset confusion, and blurred vision, who do you suppose will need our attention first? In this case, the patient with sudden onset confusion and blurred vision would need our attention first. They are in an acute, unstable condition. Our chronic, stable COPD patient will be getting our attention next. All right, let's apply our frameworks to a quick case study. You walk onto the unit and see 3 patients. Mrs. L is complaining of chest pain. Mr. J is due for his scheduled insulin. And Ms. T is anxious about her upcoming surgery. In what order do we attend to these patients? Let's talk through our frameworks to decide. First, our ABCs. Mrs. L could be experiencing an airway breathing circulation issue. Mr. J is not experiencing an airway breathing or circulation issue. Ms. T is not experiencing an airway breathing or circulation issue. Right off the bat, this means that we will be helping Mrs. L first. Next, let's look at Maslow's pyramid. Mr. J is requiring his medication. Medication is a basic physiological need. Ms. T is concerned about her upcoming procedure and is anxious. This falls under the safety category of Maslow's pyramid. Based on Maslow's pyramid, we need to help Mr. J next, because basic physiological needs must be met first. And lastly, we can use our acute versus chronic, unstable versus stable framework. Ms. T, though in an acute state of anxiety, is quite stable. So we will help her third. Our final prioritization order is Mrs. L, Mr. J, then Ms. T. Let's recap. Always begin with the ABCs. Use Maslow's pyramid from the bottom up, and always prioritize acute unstable patients over chronic stable patients. When in doubt, ask yourself, what's going to harm the patient first? Excellent work, everybody. In the next video, we'll put all this into practice with NCLEX-style questions and help you tackle those tricky select all that apply and NGN formats. See you there.